just discussed this, that MBBS report which was published, and this is important because this is just being recently published, and if you want to access this report, you can Google it, MBBS UK 2020 report, and this gives you the statistics between 2016 to 2018, and the indirect causes, the most important is cardiac death, cardiac disease, followed by neurological causes, epilepsy or stroke, and the direct cause of death is thrombosis and thromboembolism. And the second important cause, direct cause of death, is maternal suicide. So again, we've discussed what does venous thromboembolism refers. It refers to the development of clots or thrombus inside the veins, and this is a leading cause of maternal death in the UK. It can present mainly as DVT or deep vein thrombosis or pulmonary embolism. And pulmonary embolism is a life-threatening situation wherein the thrombus breaks and it can travel via the pulmonary vessels to the lungs, and it may ultimately result in collapse and mortality also. So this is something which is very important, that as per the GTG guidelines, which is 37A, all of you can download the 37A guidelines, the GTG guidelines, and I have just tried to make it very simple. So here today we'll be just discussing the risks, the risk factors, and what is the management which needs to be done based on different risk factors. So 37A is the guideline number. This is 2015, and this can be easily downloaded from Google, and I request all of you to download it and go through the entire guidelines. And after the webinar today, it'll be much simpler to go through the guidelines. Even though I'm covering everything, so you really don't need to, but I think you should still go through it once. Okay, so what is important is a risk assessment for VTE for all women early during pregnancy or before pregnancy. So it could be even prior to pregnancy or while she's pregnant. That time you should conduct a risk assessment for all women. And this needs to be repeated again if she's hospitalized or she develops some other intercurrent problems, because her risk may change.